I would like to highlight several things. First of all, it's the 6th edition, and I think that one year after the other one, we are consolidating this meeting as the biggest meeting in Europe in the CAR T-cell field. Although you have smaller meetings, this one is the biggest one. We have reached a little bit more than 1,000 registered people and being face-to-face in the meeting, which I think that it's a success because, of course, it's a very interesting topic, but there are not so many people dedicated to CAR-T. And, of course, we are post-pandemic, more and more far away from COVID-19, but I think that things have changed quite a lot after COVID-19. I also want to highlight that it's really a very comprehensive and a very inclusive meeting because we try to bring translational and basic research together with clinical research sessions, also regulatory sessions dedicated to understand how CAR-Ts are being used around the world and all this concept of accessibility to CAR-Ts. We have let's say, patients and patients advocacy groups that have their own roundtables too, and also the trainees coming from EBMT and EHA. So I think that it's really very inclusive, the meeting in this sense. It's also a joint effort between EBMT and EHA, or EHA and EBMT, and this is also important because this makes sometimes all these processes maybe a little bit more complicated and more difficult to take forward. And I think that we were able to bring a really very interesting program with top 10 speakers from the clinical point of view, the translational and basic research point of view. And I want to highlight the keynotes, but there were also many presentations that were really very interesting.